Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 12, 2025. This video is on an article published in the European Journal of Heart Failure titled Primary Cardioprotective Effect of Sacubitril Valsartan in Breast Cancer Patients Receiving Adjuvant Therapy, first published 10 July 2025. Cancer therapy-related cardiac dysfunction is a major complication of chemotherapy, and targeted therapy, especially anthracyclines and HER2 inhibitors. Sacubitril valsartan is an angiotensin receptor neprilysin inhibitor, ARNI. It improves outcomes in heart failure, but its role in cancer therapy-related cardiac dysfunction prevention is underexplored. This study aimed to evaluate primary prevention of cardiac dysfunction associated with chemotherapy in early breast cancer patients receiving adjuvant therapy. It was a randomized, open-label, blinded endpoint trial. Study cohort comprised of 100 treatment-naive early breast cancer patients, mean age 50.4 years, plus or minus 8.5. 98% were women. Randomization 1:4 ratio, 20 patients on sacubitril valsartan versus 80 on standard care. Intervention, sacubitril valsartan 12.275 milligrams twice a day, starting 3 days before therapy, titrated as tolerated. Follow-up 12 months, echo biomarkers every 3 months. Primary endpoint, cancer therapy-related cardiac dysfunction, greater than 15% relative decline in global longitudinal strain, or greater than 10% drop in left ventricular ejection fraction to less than 50%. Chi-square and Fisher's exact test were used statistically, powered to 80%. Alpha was 0.05. What did they find? They found that chemotherapy-related cardiac dysfunction incidence was 0% in the sacubitril valsartan group, was 26.3 in the standard group, p-value 0.006, number needed to treat 3.81. All chemotherapy-related cardiac dysfunction events diagnosed via decline in GLS, most occurred within 6 months. No mortality, heart failure hospitalization, or severe adverse events. 2 patients discontinued ARNI due to hypertension. In the low-risk subgroup, 0% chemotherapy-related cardiac dysfunction in ARNI was 28.4% in standard care, p-value 0.009. Limitations: it was a single-center study, small sample size, 100 patients, unequal randomization, 1:4 ratio, may introduce imbalance, short follow-up period 12 months, no long-term outcome data. Key takeaways: low-dose sacubitril valsartan markedly reduced chemotherapy-related cardiac dysfunction in early breast cancer patients receiving adjuvant therapy. GLS, global longitudinal strain-based monitoring, enables early detection of subclinical LV dysfunction. Phase 3 trials are needed to confirm efficacy and assess long-term benefits. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master Medfacts at mastermedfacts.com.